The work I planned to undertake as a Topol Digital Fellow was to build upon an earlier proof of concept remote monitoring service in rheumatology at Guy's and St Thomas's, and to expand the digital service to support patients with rheumatoid arthritis, to track and monitor their disease activity between hospital visits, whilst also being able to alert clinicians to any deterioration in their condition. I plan to do so through the user-centred design and delivery of a two-way short messaging service between patients and their clinical team through the exchange of patient-reported outcome measures. As I began my Topol Fellowship in September 2019, the reality for many rheumatology outpatient services was an outdated and unsustainable operating model, where often patients in disease flare were sitting longer in the waiting room than they should, alongside patients in disease remission, often attending unnecessary appointments. And so the problem I was facing was how best to optimise follow-up appointments whilst ensuring everyone feels looked after. My Topol Fellowship gifted me time to lead an agile multifunctional team engaging multiple stakeholders across the South East London integrated care system to deliver a cross-boundary solution to a shared problem. And 260 patients are actively engaged using this service across 5 hospital sites, across 3 NHS trusts. And patients report a strong sense of trust in the service, getting care when they need it most, and feeling looked after in their home. I could not have predicted the growth of interest in remote monitoring prior to embarking on this work. And triggered by the COVID-19 pandemic and the real necessity wherever possible to deliver care outside of the hospital, I'm most proud of our achievement of being able to scale the remote monitoring service, reaching more patients with rheumatoid arthritis across South East London at a time where many were facing their greatest challenge in accessing care when they needed it. Although my Topol Fellowship has come to an end, designing good services never stops. I remain really closely involved with the evaluation of the service and its impact at ICS level. What I really want to ensure, however, is that as a proud physio and a passionate digital AHP leader, the capabilities of the broader workforce in leading digital transformation is recognised here, and that the lessons that we've learned on scaling across an ICS during a pandemic are shared widely to support digital transformation. Very soon I will be taking some exciting steps into a new full-time role at NHSX, and I will be taking the full breadth of my experience as a Topol Fellow with me. But what I'll also be taking is a sharp focus on what really matters to patients and the importance of inclusive digital transformation when embarking on pathway redesign across health and social care. As a Topol Fellow, and proudly the first female physiotherapist in the UK to hold such an award, my experience has been the most empowering and inspiring in my 24 years as a clinician in the NHS. I have had my hand held by the greatest network of peers and friends throughout my fellowship, and I wish to thank everybody from across the programme for showing me such support. I'm excited for their futures and that of my own as future digital leaders across health and social care. We are truly better together thanks to programmes such as the Topol Fellowship, and I wish to thank Health Education England for supporting my experience. Transformative.